Thanks for the introduction. So, as we already saw also in the past presentation, one of the big challenges for focused ultrasound surgery in abdominal organs is the management of respiratory motion. So liver, kidney, and pancreas can move up to 2 centimeters, so it is crucial to manage this motion. So how it is possible to compensate this motion? We can freeze the movement, or we can follow the movement. In the first solution, the breathing is stopped thanks to a mechanical external ventilator or apnea. But this solution is not always safe and acceptable, so maybe it's better to try to follow our target. So how can we do that? We can use a multi-phased array able to steer the focus in the 3D space. So in this case, the transducer is fixed. Or we can use an active manipulator that is able to follow in real time our organ. So there are we will see 2 different solutions. We can move the transducer in linear, or the approach that we are proposing is move the transducer in angular and then adjust the axial steering of the focus. These works come from an European project, the Futura project, which aim was to develop a robotic ultrasound-guided platform for focused ultrasound surgery in abdominal organs. So briefly, the platform is composed mainly by 2 manipulators, one holding a 3D imaging probe, and the other one holding an HIFU transducer with a confocal 2D imaging probe. So firstly, we have to understand which is the trajectory of our target. So we can select a region of interest from the echographic image, and the trajectory is detect, learn, and predict. So as you can see, this data then can be given to the robot that starts to follow real time the target. And as you can see, the image is fixed in the screen. So we are able to perform the sonication, as you can see in this case, in a tissue mimicking phantom. So we try both the strategy. The linear one, so with the linear one, we move the transducer in phase with our organ. So this is the simplest solution, but this is not, how to say, it's not easy to apply this method in vivo because there is a continuous modification of the acoustic window. So in presence of reflective tissues, such as ribs, that they can intercept the beam. So the different approach that we try to demonstrate is this, that is the angular motion of the transducer. So in this case, we can fix a pivot point. So there is a minimization of the modification of the acoustic window. So the transducer moves in angular, and as you can see from the image, only the focal point is fixed in the screen. We also demonstrate the skin contact control. So we used an abdominal simulator, and we were able to regulate the force applied to the skin. So this is very important to guarantee a good acoustic coupling and also to avoid dangerous forces to the patient. So we demonstrated the precision and accuracy of our method. The tracking error was always lower than 1 millimeter. And we performed also some sonication, so some thermal ablation in ex vivo tissue, in this case chicken breast. And as you can see, the ablation performed in static condition and dynamic condition by applying the following strategy were very similar in shape and volume. So in order to conclude, a continuous modification without breathing suppression technique can be beneficial for the treatment of abdominal organs. We demonstrate an innovative ultrasound tracking strategy based on an angular movement of the transducer. And we strongly believe that robotics can help a lot in focused ultrasound surgery, not only for tracking, but also to increase the flexibility in positioning both for treatment and monitoring. This work is going in the direction to decrease the treatment time, and so increase the number of application and widespread the focus of the ultrasound surgery in general. Thanks for your attention.
Do we have any questions? I have a quick question on your orientation. So, I mean, it's a neat concept, but and you showed it how it could work for kidney applications. But I'm having trouble conceptualizing it on how you would use it for the pancreas. How would you get your windows? Because the pancreas is a very difficult organ to target because you have a very narrow window with all the bowel gas. Do you really think you have an adequate window to approach it from two different angles?
Okay. So we demonstrated this in a simulated scenario, as you can see. Now we need the help of a clinician to find the optimal acoustic window. It's worth mentioning that this approach can be performed with only one robot. So the 3D imaging probe is used in preoperative phase to acquire volume for registration with other modalities such as CT or magnetic resonance. So this following strategy can be used only with the 2D and the FUS transducer if the clinician is able to find the acoustic window and the motion in the plane of the imaging mode.
Question?
Yes, maybe you explained it already, but if you rotate, then your distance to your target is continuously changing, as well as also the angle of your ultrasound waves. Do you compensate for that?
Do you mean the organ?
No, yeah, you are outside the body, and you rotate outside the body.
Okay.
And the target.
Yes, with the force control, we can maintain the force between the acoustic coupling and the patient. So in this case, if our target don't, goes outside the imaging plane, we can follow this. So we demonstrate in linear, so this is the simple solution. But if we have the trajectory in 3D, we can also follow in 3D the organ.
But then you keep the distance then to the target region constant?
No. Okay. We have an annular rate transducer, so because if the movement is linear and you move in angular, you cannot follow a line. So we are continually adjusting the axial steering to follow the line.
Thank you very much.
Thank you.